I'm Dr. Sri. I'm a board certified family medicine and sports medicine doctor. In this video, we're going to discuss about basal insulin. Okay, so the two commonly prescribed injections as a basal insulin are, one is insulin Lantus and the generic name is Glargine, and the other one is Levemir and the generic name is Detemir. Okay, so without further ado, let's get started. So in my clinical experience, I've had many type 2 diabetes patients who have been able to come off the Lantus insulin completely. I've had patients who were taking Lantus 40 units at bedtime, and after they started implementing the healthy lifestyle changes, which is like regular exercise, healthy eating, they're able to come off the insulin completely. I've had many type 1 diabetes patients, they're able to cut back on the insulin dosage. Remember, high insulin levels are both going to be bad for both type 1 and type 2 diabetes, except that in type 1 diabetes, they're going to be insulin dependent for the rest of their life, but still keeping the insulin injections dosage at a lower level is always good for them. So understanding how insulin works is crucial if you're using Lantus insulin, regardless of whether you have type 1 diabetes, insulin dependent diabetes, or type 2 diabetes. Once you understand this insulin, you can effectively manage its dosage during exercise or when attempting to reduce the dose as you make those lifestyle changes. So before discussing about Lantus insulin, let's first understand how insulin works on our body. So insulin is an anabolic hormone. Basically means that it builds tissues. So too low of insulin is bad, as well as too much of insulin can also be bad. Our blood sugar tries to stay between 70 to 140 milligram per deciliter. When our blood sugar goes low, our stress hormones called as the cortisol and the other hormones called as the glucagon, it tells the liver to pour some glucose into the blood. So these hormones also helps to burn fat for energy if needed. So the insulin always makes sure that it keeps in check to make sure that the fat is not being excessively burned to produce too much of ketone bodies. Ketone bodies are good, they are a good source of energy, but then too much ketone bodies can actually develop a complication called as ketoacidosis. Again, this is going to be uncommon in normal people. However, in diabetes patients, when they have a completely lack of insulin, especially in type 1 diabetes, they can develop a complication called as a ketoacidosis. In addition to that, the insulin also keeps a check on the liver. So let us say if the liver is not behaving properly with the insulin, then the liver starts to pour too much glucose in the bloodstream and thereby causing your blood sugar to increase. So there's always circulating insulin in our body at a low level, keeping this in check so that not too much ketone bodies are being produced. As we mentioned now, in type 1 diabetes, because of complete insulin deficiency, these ketone bodies production may not be kept in check, thereby resulting in the risk of diabetic ketoacidosis, which is a very dangerous complication. Unfortunately, I've seen a handful of deaths because of this condition in my clinical practice. So the diabetic ketoacidosis is a rare complication in type 2 diabetes. However, in some people, they might have severe insulin resistance, where it basically means that these fat and the liver tissues are not obeying insulin at all, and thereby it results in the increased production of ketone bodies and thereby resulting in the increased risk for ketoacidosis. So when we eat food, our blood sugar goes up. When we are stressed, our blood sugar goes up. Our pancreas will produce insulin to keep our sugars under control between 70 to 140. So what this means is that in a non-diabetic person, let us say if he's under stress, maybe due to poor sleep or work stress, his stress hormones will increase his blood sugar. However, his normally functioning pancreas will keep his sugar under control by producing excess insulin. So in addition, it is important to understand that during early morning, around between like 2 to 4 or even like 2 to 6 a.m., there is increased production of these two hormones called as the cortisol and the growth hormone, and these hormones increase the blood sugar. So these spike in blood sugar varies between different ages. For example, in growing kids during the time of puberty and stuff, so these hormones are being increased and thereby causing an increase in blood sugar spike. However, when someone has a normally functioning pancreas, they will produce excess insulin to compensate for this increased blood sugar that comes from these hormones. So in summary, what we have seen so far is that there is always low levels of insulin that is circulating in our body at all times. So this makes sure that the insulin keeps a check on the liver so that the liver is not pouring extra glucose into the bloodstream. The liver also keeps a check on the fat tissues so that not too much of ketone bodies are being produced. Otherwise, everybody can go into the risk of ketoacidosis. So in addition to that, we also seen that during increased stress and during food intake, our blood sugar rises, and a normally functioning pancreas will produce extra insulin to make sure that the blood sugar stays between 70 to 140 milligram per deciliter. So basically, there are low levels of circulating insulin in our body, and this insulin tells the liver not to produce excess glucose thereby increasing the blood sugar. So think about like the insulin acts as a commanding force for the liver so that the liver does not produce excess glucose and thereby the blood glucose stays within the normal range. But let us say if there is severe insulin resistance, like in type 2 diabetes, then the liver is not able to hear the commanding action of the insulin. So thereby the liver keeps on secreting glucose and thereby the blood sugar stays high. So in this scenario, increasing the amount of circulating insulin in our body can actually help the liver hear what the insulin is saying and thereby not produce excess glucose, and thereby you can bring the blood sugar under control. In type 1 diabetes, there is insulin deficiency, which means that there is no insulin at all in their body and thereby the liver keeps on producing excess glucose. But our body needs energy. Without insulin, the body cannot derive the glucose for energy. So in that case, the stress hormones, the glucagon and the cortisol, so they go and start to burn a lot of fat, and these fat will turn into ketone bodies. So these ketone bodies, they become acidic. So these ketone bodies can become acidic and thereby increase the complication for diabetic ketoacidosis. Again, this is rare in type 2 diabetes. However, when there is severe insulin resistance, this can happen in type 2 diabetes also. So basically, when do I prescribe basal insulin for type 2 diabetes patients? So let us say if the A1C is more than 9, or let us say if the A1C is more than 7, in spite of maximizing all the oral medications for diabetes, then I'm going to consider starting them on insulin. Again, it doesn't always have to be basal insulin. I'll probably start them on insulin 70/30, which I've covered insulin 70/30 in a separate video, and I'll link at the end of this video, or I would start them on a basal insulin first. So the Lantus insulin action is almost 24 hours. But as you can see here, the Lantus insulin does not have a peak. So for example, let us say if someone is taking Meal Time Insulin, so like a rapid acting insulin, then the insulin is going to spike like that and they're going to come down. But as you can see, Lantus does not have any peak or anything like that, which means that the risk of low blood sugar is very, very low. However, let us say if you're supposed to inject 10 units of Lantus daily, but instead you inject 20 units of Lantus, then unfortunately the Lantus is still doesn't have a peak, but then your Lantus insulin is going to be like this, which means that it's going to drop your blood sugar at certain times. And that could be sometimes when you're really active and you're exercising, and the Lantus insulin can drop your blood sugar at that time. So, but however, let us say if you take the right amount of insulin, and the good thing about this insulin is that there is low risk for low blood sugar. So how it's important to remember. So let us say, and again, I'll cover in a separate video on how to adjust Lantus when you start to implement healthy lifestyle changes and stuff. But let us say you decide one day, you say that, you know what, I'm going to start exercising regularly, I'm going to eat healthy, I'm going to cut back on sugar, I'm going to eat low glycemic index foods and stuff like that. Then in that case, the Lantus will start to increase the risk of low blood sugar. So during those conditions, our focus will be to slowly cut back on the insulin, slowly implement the healthy lifestyle changes, and eventually, if we can actually cut back on the Lantus insulin completely. So all they know is that the liver is just producing excess glucose all the time, and if we increase the basal insulin, then his blood sugars might do really well. So I'm going to start him on Lantus. So Lantus is one of the basal insulin, also called as a Glargine. Remember the other Levemir insulin, which is the insulin Detemir, can also be started kind of similarly. But anyway, the Lantus I'm going to start with 0.1 to 0.2 units per kg, and this, let's say this person is 60 kg, then I'm going to start between 6 to 12 units. So it all depends. Sometimes if I feel good, then I'll start on 12 units. But let us say if this is an elderly person, I want to be very careful about low blood sugar, then I'll probably start them on 6 units. So then I would ask them to check their fasting blood sugar daily. So let us say the fasting blood sugar is less than 70, even just for one day, then I would decrease the Lantus by 1 to 2 units. So let us say they're taking 6 units, then I'll probably decrease the Lantus by 4 units or so. But let's say the fasting blood sugar stays between 70 to 140 all times, then no change. But let us say the fasting blood sugar stays between 140 to 250 for 3 consecutive days, then I would increase the Lantus by 1 to 2 units. But let us say the fasting blood sugar is between 250 to 300 for 3 days or so, then I would increase the Lantus by almost like 2 to 4 units or so. Again, depending on the individual, I might do 2 or I might do 4, depending on the age group and things like that. So once he gets his fasting blood sugars under control, it's important to make sure that he sticks to the particular diet. So let us say if that person is sticking to a particular diet, and then after like a few months or so, then he starts to engage in a lot of junk foods and stuff, then we might need to adjust the insulin again in order to get the blood sugars under control. But same way, let us say one decides, let us say the person is actually eating a lot of junk food and we got their blood sugars under control, but then decides to implement healthy lifestyle and stuff, then we might have to again adjust the Lantus, so basically cut back on the Lantus dose slowly as we continue to implement those lifestyle changes. So usually I'll bring them every 2 weeks or every 3 weeks or so, adjust the Lantus insulin, and then we'll recheck his A1C, which gives us the average blood sugar for the last 3 months. And let us say if I achieve the goal, or basically of like A1C less than 7 or so, then we're good. But let us say if his A1C drops to 8, but his fasting blood sugars are good, but still if his A1C is around 8, which is still not a well-controlled diabetes, in that case, then I'm thinking about postprandial high blood sugar. So basically blood sugar spikes that happens after eating, which might be causing his A1C to still be to be around 8 or so. So in that case, we discuss about meal time insulin, again like injecting insulin during the time of the meals, and again I'll make that as a separate video, okay? However, in type 1 diabetes patients, they need both basal insulin and meal time insulin. So in type 2 diabetes patients, there is always some amount of circulating insulin which can help with the meal time insulin. However, in type 1 diabetes, they need both, okay? So the other question is that what is the difference between Levemir and Lantus? So the Lantus action is almost for 24 hours, whereas Levemir is between 18 to 21 hours. So what that means is that the Levemir has to be dosed twice a day, so 2 injections per day, whereas Lantus just 1 injection per day. In addition, Levemir, as you can see here, it may have a small peak of the insulin, which can increase the risk of hypoglycemia at some point. However, Lantus is relatively peakless insulin. So that's it, guys. I hope this video was helpful. If you have any questions or concerns, please post in the comment box below. If you really found this video helpful, can you please hit the like button so that this video can help more people, okay? And if you're interested in knowing about the insulin 70/30 injection, so basically a combination of regular insulin or rapid acting insulin along with NPH insulin, then please check out this video and I'll see you in my next video. Until then, goodbye.